Hi, my name is Lizbeth Acosta, and I'm here to inform you about barbiturates, their use and effects on the body, as well as risks and other important information. Barbiturates are classified as central nervous system depressants. The central nervous system consists of the brain and spinal cord. These drugs became popular in the early 1900s, replacing bromides as the most popular relaxation drug, as they were initially seen as safe depressants. Barbiturates play a large role in therapeutics because they are very effective as sedative hypnotic agents. This allows them to be used for the treatment of anxiety, agitation, and insomnia. Barbiturates have a very small margin of safety, meaning that the dose for a safe reaction is not very different than a catastrophic dose. Additionally, barbiturates have a high abuse potential due to their sought-after relaxing effects. For these two reasons, benzodiazepines have replaced barbiturate use in most medical treatments. Barbiturates are now typically used medically as sedatives and hypnotics through injection or oral intake. Smaller doses can be used to relieve tension and anxiety. Higher doses can be used as anesthesia or as coma-inducing drugs, depending on the dose. Because of the small margin of safety I previously mentioned, the doses for anxiety relief and anesthesia are not very far apart. This makes the toxicity level of the drug very low, increasing the possibility of overdose. Because they are less frequently prescribed, barbiturates are becoming less readily available, and their abuse is less frequent in the United States. However, even though the therapeutic use is declining as well, 4.3% of high school seniors claim to have recreationally used a barbiturate. Barbiturates are sometimes referred to as downers because they are often used to negate the effects of so-called uppers, stimulants like amphetamine or cocaine. Other generic names include, but are not limited to, barbs, dolls, red devils, or sleepers. Recreational users typically use barbiturates because they create a feeling similar to being drunk. This may account for the use of barbiturates by high school seniors and college students. Barbiturates do not act on a specific receptor site, and it is believed that they have a general effect that enhances the inhibitory neurotransmitter gamma-aminobutyric acid, or GABA. The fat solubility of barbiturates also influences their effect on the body, with fat-soluble barbiturates being shorter acting and faster eliminated from the body. Fat-soluble barbiturates are also much more likely to be stored in fatty tissue. This causes a change in effect of the drug depending on the user's amount of body fat. Because women typically have a higher percentage of body fat than men, their reaction to barbiturates may vary in intensity and duration. Effects of barbiturate use include loss of inhibition, euphoria, and anxiety relief. Side effects may include delirium, nausea, nervousness, rash, diarrhea, difficulty making judgments, emotional instability, lack of coordination, and slurred speech. As you can see, the side effects are very similar to alcohol use. Prolonged or continued misuse of barbiturates can have a life-threatening cumulative effect on the central nervous system. Too large of a dose, or use with other depressants, can cause death from respiratory or cardiovascular depression. Withdrawal from central nervous system depressants can mimic the condition for which they were being taken. Withdrawal from barbiturates can cause hyperexcitability or anxiety due to the rebounding of the previously depressed neural systems. Discontinuing the use of barbiturates in people who are using large doses can cause even more serious withdrawal effects, such as seizures. Because of the abuse potential for barbiturates, the Federal Drug Administration included barbiturates in the Controlled Substances Act. Short-acting barbiturates such as phenobarbital and secobarbital are currently classified as Schedule II drugs, whereas long-acting barbiturates like phenobarbital are Schedule IV drugs. Hopefully, now you feel adequately informed about barbiturates and you understand the risk and consequences that can be associated with their use. Thank you for watching!